Hi, I will be presenting on hypertension. Technically, this is the same patient, but with just a few changes. Patient DJ is a 53-year-old male Pacific Islander who presents to Bay Clinic Hilo on February 13 at 10 a.m. for BP follow-up in the treatment of hypertension. Patient reports no dizziness, headache, chest pain, or heart palpitations. However, patient does report lightheadedness when abruptly getting up after having been in a lying position. History of present illness. DJ was previously on hydrochlorothiazide. However, medication was discontinued due to secondary gout exacerbations. In addition, patient reports finding of blood in his urine, which is further being evaluated. Patient has been diagnosed with hypertension, chronic kidney disease, gout, cervicalgia, and major depression. Patient's father is deceased, and his family history includes history of stomach cancer and leukemia. As far as social history is concerned, DJ is a current smoker who smokes about 1 pack per day for about 10 years. His current stress levels are under control, and he currently walks about 1 to twice a week for about a mile since January. Patient enjoys eating rich foods such as steak and food high in salt content. As far as ethanol, recreational drugs, caffeine, and sexual activity is concerned, information is unavailable. His immunization history is also unavailable. For review of systems, negative findings include that patient reports no symptoms of headache, heart palpitations, shortness of breath, dizziness, or blurred vision. For positive findings, patient reports experiencing pressure in ears sporadically. Also, DJ experiences lightheadedness when abruptly getting up, as mentioned above. Overall, patient appears alert and well-nourished with somewhat slight difficulty in hearing. For medication adherence, information is unavailable. For vitals, DJ presents to the clinic with a BP of 138/82, down from 148/92 on January 9, 2012. His heart rate is 67 and his respiratory rate is 16. His temperature is normal and he weighs about 101.5 kilograms. His height is 5'11". For labs and other findings, patient has an IBW of 75.3 kilogram. His BMI is 31.1 kilograms per meter squared, which is considered obese. His basal energy expenditure is 2,005 kcals per day, and his creatinine clearance is 29.8 milliliters per minute. His transaminases levels are within normal limit, and his BMP is also within normal limits. His lipid panel includes slightly elevated triglycerides and LDL levels. Other physical findings include that patient has no pitting edema upon palpation. Patient is allergic to gemfibrozil, fish oil, shellfish, contrast dye, and niacin. His current medications for hypertension include losartan, 25 milligrams 1 tablet PO daily, carvedilol, 25 milligrams 1 tablet BID with food, and nifedipine, 60 milligrams 1 tablet daily. For dyslipidemia, he is taking simvastatin. For gout, he is taking Colchris and indomethacin. For major depression, patient is taking risperidone, and for pain, he is taking Tylenol and capsaicin. In terms of assessment, major cardiovascular risk factors per JNC7 include cigarette smoking, obesity, physical inactivity, dyslipidemia, diabetes, microalbuminuria, age, and a family history of premature cardiovascular disease. Patient is positive for 3 major risk factors, which include cigarette smoking, obesity, and dyslipidemia. In addition, per JNC7, DJ suffers from chronic kidney disease, considered as an identifiable cause of hypertension. His Framingham 10-year CHD risk score is 12%, and his vascular age is 68 years. For current therapy, DJ requires continued therapy for hypertension because he has a compelling indication of chronic kidney disease. In addition, DJ is not at goal of 130/80 for his BP. Treatment is indicated to decrease risk of heart attack, stroke, heart failure, and prevent target organ damage. As mentioned above, patient is currently taking for treatment of hypertension losartan, carvedilol, and nifedipine. First-line treatment for patients with CKD and hypertension per JNC7 is an ACE inhibitor or an ARB, angiotensin receptor blocker. Because DJ suffers from chronic cough, an ARB is more appropriate treatment. DJ is currently taking losartan potassium 25 milligrams, 1 tablet daily. Losartan is appropriate for the patient given that ARB can potentially decrease decline in kidney function and reduce progression of chronic kidney disease per AASK trial. Route of administration and dosing interval is appropriate for DJ since both allow for feasibility of patient compliance. However, dose is ineffective for the patient since his BP is still not within desired goal of less than 130/80. Carvedilol, on the other hand, is a mixed alpha-1 and beta blocker. Carvedilol beta blocker is an appropriate add-on therapy for treatment of hypertension in patients with CKD per KDOQI guideline recommendation. DJ is receiving the maximum dose per day of carvedilol with an appropriate route and frequency. However, it must be noted that patient experiences orthostatic hypotension, a side effect commonly associated with carvedilol. Nifedipine is a DHB calcium channel blocker. Per KDOQI, calcium channel blockers are considered as an appropriate add-on therapy in order to achieve BP goal. DJ is currently taking the maximum dose of nifedipine, where his oral route and frequency is appropriate since it also allows for feasibility of patient compliance. Therapeutic alternatives. Other therapeutic alternatives for treatment of hypertension, considering DJ's comorbidity of chronic kidney disease per JNC7 and KDOQI guidelines, is an ACE inhibitor, but as mentioned above, patient is unable to take any ACE inhibitors as patient is intolerant to the cough associated with ACE inhibitors. Another alternative is diuretics. However, thiazide and loop diuretics are contraindicated in patients with gout. In DJ's case, hydrochlorothiazide exacerbated his gout, impairing his ability to walk and resulting in joint swelling and muscle aches. Alternative agents for treatment of hypertension per JNC7 include alpha blockers, central alpha-2 agonists, and direct arterial vasodilators. Alternative agents have not been proven to reduce the risk of cardiovascular events. In DJ's case, alternative agents are not appropriate because they may potentially aggravate his orthostatic hypotension. Furthermore, alternative agents may cause fluid and sodium retention and are therefore recommended to be taken concurrently with diuretics. However, DJ cannot be on a diuretic because of gout exacerbations. In addition, specifically with alpha-2 agonist, a side effect is depression. DJ has been diagnosed with major depression, so central alpha-2 agonists are not recommended. As far as medication interactions are concerned, a potential interaction occurs between indomethacin and carvedilol. Per facts and comparisons, the antihypertensive effects of carvedilol may be decreased by indomethacin. Also, all three antihypertensive medications DJ is currently taking have a potential interaction which may result in additive effects. For plan, recommendation for drug therapy. For losartan, patients should continue taking the ACE angiotensin receptor blocker since it is considered first-line treatment for patients with compelling indication, in his case chronic kidney disease. However, because DJ's BP is not currently at goal, I would recommend to increase his losartan dose to 50 milligrams every day and to monitor his serum potassium levels and BP. In addition, I would recommend to gradually taper down his carvedilol dose upon increasing his losartan dose. Blood pressure and symptoms of orthostatic hypertension should continuously be monitored when lowering his beta blocker. DJ should also continue taking nifedipine, his calcium channel blocker, as prescribed to achieve his BP goal. For medication reconciliation, there is none to discontinue. Recommendation for drugs to consider avoiding based on patient-specific parameters. For JNC7, drugs that will induce his hypertension include NSAIDs, COX-2 inhibitors, sympathomimetics, adrenosteroids, and cyclosporin and tacrolimus. He should also consider avoiding for when he's taking losartan, potassium-sparing diuretics, potassium supplements, and lithium. Other drugs he should consider avoiding include beta-2 agonist, digoxin, rifampin, salicylates, selective serotonin uptake inhibitors or SSRIs, grapefruit juice, macrolide antibiotics, protease inhibitors, and CYP450 inducers and inhibitors. Recommended test. No further tests are recommended as of the moment. Our goal for DJ is to maintain BP, blood pressure of less than 130/80. For monitoring parameters, we should monitor for progressive target organ disease. We should monitor for efficacy by rechecking his blood pressure in 2 to 4 weeks upon any change in his dosing regimen. For ARB, we should monitor for his BUN and serum creatinine levels, as well as his serum potassium levels. And for his beta blocker and calcium channel blocker, we should monitor his heart rate and BP as well. Drug-related side effects to monitor for all 3 of his medications include angioedema, hyperkalemia, hypotension, bradycardia, dizziness, fatigue, reflex tachycardia, swelling of extremities, dizziness, lightheadedness, headache, nausea, and any flushing or heat sensation. For patient counseling, I would tell DJ, first of all, I would recommend that to ensure your blood pressure medications are working for you, you must monitor your blood pressure frequently. I recommend that you get a BP home device so that you can closely monitor your BP level at home. DJ, if you're experiencing any chest pain or pressure, palpitations, dizziness, shortness of breath, headache, or any sudden changes in vision, please contact your doctor. Also, please keep all your medications away from sunlight, moisture, and out of the reach of children. Take all your medications as prescribed. If you miss a dose, take it as soon as you remember. But if it comes close to your next dose, you can go ahead and skip that next dose or that previous dose and take the dose you are scheduled for that day. If you're experiencing lightheadedness or dizziness, go ahead and sit down so you won't fall when you abruptly stand up. This is because blood must go back to your brain, and abruptly standing up may cause you to get lightheaded. Make sure to drink enough fluid and water to avoid lightheadedness or fainting. Remember that these medications are not to cure you, rather they are to prevent long-term complications and serious side effects. Continue to take your medications as prescribed even though you feel better in order to prevent future complications. For non-pharmacological intervention, I would tell DJ that eating rich food may satisfy your stomach, but in the long run, it will not be good for your health. Try as much as possible to have colorful fruits and vegetables in your diet, and limit your intake of salt. If you are walking now, once or twice a week, the next time you walk, maybe you can increase that to 3 to 4 times a week. Or if you walk for 30 minutes, you can gradually increase that to 40 minutes or 45 minutes. The most important thing that I have to recommend for you today is to stop smoking. Smoking affects not only your hypertension, but overall I cannot stress how bad it is for your health. And for information resources, DJ, this is a handout that shows you what you should be eating each day. It is from a government website, www.choosemyplate.gov. For smoking, there are many resources out there of which I can direct you. But since you are here in Hawaii, Hawaii has this free tobacco program where you can call 1-800-QUIT-NOW. Your tobacco coach will guide you, and all you have to do is finally decide it's time to quit smoking. Thank you, DJ, and have a nice day. Thank you.